The financial impact is going to be huge. I mean, one of the biggest impact so far has been the suspension of all elective procedures. So hospitals are now only doing things that are emergent, urgent, and they're taking care of COVID patients. Some hospitals are overrun with COVID patients and some are not. So the revenue stream is greatly decreased. They will be paid, obviously, for taking care of COVID patients, but it will be much lower rate than they say would be getting if they were doing surgeries and other things like that. For smaller organizations like physician practices, another huge impact. We're seeing furloughs of workers all over the country. I think that's happening with a lot of organizations that perhaps were already struggling, but we're going to see that in probably organizations that were a little more robust in the long term. So that's one of the really alarming things. A lot of them are non-clinical workers that are being furloughed. But we're in a shortage already all over the country of clinical workers. So if you have cross-trained non-clinical, maybe they can come in and work by the bedside. But only time will tell the true impact. Hospital organizations are already operating on the slimmest of margins. So any reduction in revenue is going to have a tremendous impact. So healthcare has been in an era of quality for a while now, since the late 90s. So my hope would be that most organizations have had such an emphasis on quality, it's so hardwired into their organizations that continues. That's just a part of their culture. Now, obviously, a lot of organizations are very stressed. You've got nurses, for example, that are working in areas where they may not have worked before. So, that could impact the quality. We'll see in the future. There obviously will still be measured on quality in terms of reimbursement, so they have to keep a mind of that because it impacts their bottom line. It's interesting, all the improvisations and innovations that are happening. Some of them may make great new changes in our care. Some of them could be detrimental, but we'll have to wait and see on that. Well, first, I know most health professionals and physicians' offices are, communicating with their current patients to say, if you don't need to come in, don't come in. If you are going to come in, please call us ahead of time so we can tell you how to access, how you're going to come to the office and how you're going to enter the office and what protections we have in place. So that's one of the main messages I think that we'd want to get out to folks. As far as what they do within their organization, I guess it would depend on the size of the organization and whether they have you sit in the car until it's time for your appointment and they bring you directly in the door and back to a room rather than set you in a waiting room with other patients where you could possibly be exposed. I think we'll see a tremendous amount of change just because every crisis that we've gone through as a nation, even as a world, has brought about great innovations in healthcare. For example, right now we're seeing a widespread use of telehealth to a degree that it's never been used before. So they've been loosening restrictions that have been in place that really kind of hindered the spread of telehealth. So I think that once that genie's out of the bottle, so to speak, it's hard to claw it back. We're seeing that we have problems with our supply chain and that we're so heavily reliant on foreign materials that we need to maybe ramp up our domestic production so that we don't have those problems in the future.